The goals of the residency there are three. One is to develop a strong, competent resident with a strong knowledge base. Two, to develop some confidence so that they can go out, provide information and help our patients. And three, develop the skills to give back to pharmacy, to precept and help the next generation of clinicians come up through the profession.
In our program, I'd say that our residents experience the opportunity to be really seamlessly integrated into clinical practice. They are seen as a practitioner alongside their preceptor. I think they experience a lot of support and kind of a genuine enthusiasm from our preceptors and an interest in their growth and development.
Residents experience a lot of things during the 365 days they're with us at Richland. A lot of clinical experience through various areas of the hospital, critical care, pediatrics, internal medicine. Lots of opportunities for research with a longitudinal project that goes through the IRB process, gets presented as a poster, as a platform presentation. Lots of opportunities to precept and complete the teaching certificate offered by the College of Pharmacy at the University of South Carolina. Ultimately, becoming a competent and confident clinical practitioner that can help provide good patient care and train future generations of pharmacists.
Some of the factors that drew me to this program specifically were the robust opportunities within the ambulatory care setting in various clinics, as well as the opportunity to participate in the teaching certificate program and mentor and precept pharmacy students. And when I interviewed here, the preceptor group was also very personable and supportive, so I knew I would thrive here.
As soon as I walked onto campus during my interview, I met a ton of different pharmacists and residents that I immediately clicked with, and I got to know them at a deeper level than some of the other programs I was looking at. And I feel like that just has continued to progress as a resident and being with those preceptors on a daily basis and getting to know those residents.
The culture at Prisma Health is definitely one of the factors that drew me here. It is very supportive. The preceptors are all very involved, desire to see residents grow and thrive. And I think that fostering of a safe environment to learn and grow in autonomy is definitely a key aspect of our program.
A resident here at Richland, a first-year resident, spends the majority of their time at Richland Memorial. They could be in critical care in the ICUs, they could be rounding with the internal medicine team, they could be in the children's hospital. They do have the opportunity to go through some of our ambulatory care clinics, both on campus and in the Columbia area. And they do have the opportunity to work with preceptors at other campuses, both here and in the upstate.
It's always funny when they start making their schedule. We have more rotations than you can take in 2 years of training. And so I guess that just speaks to the opportunity to really individualize your learning experiences and focus those on goals.
The day-to-day basically looks like patient care in the morning with rounding with their respective teams, meeting with their preceptors, and then can follow up in the afternoon with project time or other meetings that are really part of just being a pharmacist and part of a large health system.
Currently, I call myself a baby pharmacist, but every day I feel like I'm building into a real pharmacist, and I'm able to practice those skills during rounds and getting to independently round with the attendings and the medical residents and students and fellows. And I've gotten to experience working with different pharmacists and different areas of the hospital. I think residency is such a big growing process, and I think Prisma does a really great job in setting us up for success and supporting us throughout the whole process. I think Columbia is a little bit of a hidden pearl within the East Coast / South side of the US. I feel like being from the Chapel Hill area for pharmacy school, that's like very much young professional area, Triangle area, and then I come down to Columbia and I realize there's way more to it than I had been told.
So I'm originally from Dayton, Ohio, and one of the aspects that was also a plus with this program is the warm climate of Columbia. And when I came to interview here, I could see all of the activities that were available outside of residency to participate in with my co-residents. They have lots of great restaurants here. They also have lots of festivals. and markets every Saturday morning to go downtown and explore. So that's definitely a plus with living in Columbia.
When residents finish our PGY1 program, they are very competent, very confident, and are very marketable. Many go on to a second year, a PGY2, and specialize in certain areas, critical care, infectious diseases, pediatrics. Others can go straight into the clinical field and be very strong clinical practitioners right away.
Our goal is really to walk alongside each resident and individualize our program to help them meet their professional goals.